Thank you so much, Bragin. I'm really privileged and I'm happy to be here. I think I'm finally is in my tribe as we should brilliant morning. And before starting up, I'm going to reflect because I had so many good speakers before me that they're gonna save me a lot of work that I already put in these slides. So I'm gonna reflect on instead of saying that I had the acknowledgement, I'm gonna reflect on the passing of Maurice Sinclair, who was actually the counselor emeritus of Queen's University, where I come from Kings, Ontario. So I followed us next up there. And also the learnings I've been taught by several indigenous patients and police in the indigenous pharmacy professionals of Canada, particularly Amy Labby and Jaris Sordovich. They are like pioneers in this. But I'm not going to say anything other than a story. The day before the Black Friday apocalypse, which was, I think you remember it, March 13, 2020, when everything was shut down, I was invited to do a talk at the base in Kingston, the military base, okay, about health and wellness. And I talked at that time about health as a state, wellness as a state, and there is an area in between those, when you start to see signs and symptoms. And that's where we can mitigate early and reflect, actually reverse those things. And I spoke at that moment about Western medicine, but also spoke about traditional, indigenous kind of practices, talked about Chinese medicine, Ayurveda, and all the Middle Eastern practices, and said that there's not only Western medicine is great, it's evidence-based, but also there are other practices we cannot ignore. It was a 45-minute talk and it was received very well. 3 weeks later, I got a letter from my college, a pharmacist. Somebody complained me to the college that I was promoting shamanic practices because I spoke about that there are things other than Western medicine. So that shows you how much happy I'm here today, because probably it's going to take that effort and send better to the college. So hopefully not. So,
Rido.
okay, here we go. So I wouldn't be here today without Weller Pharmacy, which is my own community independent pharmacy in the northeastern side of the city of Kingston, where there's a transient community, high addiction, mental health, lots of need for social connection. That's the word. And also my team who's working today while I'm here, I'm very grateful for them. I also want to share my connections with the Canadian Association of Pharmacy for the Environment. I am their Director of Content Portfolio. The International Social Prescribing Pharmacy Association, which I'm co-founder, and I'm very proud also to be one of the early, also I don't say founder, but early people who work with the Canadian Institute of Social Prescribing under their student collective group, where I lead the research working group. And I'm actually really happy that Jeffrey is here. He's one of the leaders of the student collective, and he's here today to join. I'm not going to talk much about the numbers because you know that, but if you read 1,500 different statistics, pretty much you get these numbers. The numbers are the same. What is interesting for me here is that the people who reported that they are lonely and socially isolated are higher when we get it, they have chronic conditions. You see here, it's almost 90% of the people who have chronic conditions, they report that they are having loneliness issues, which is really profound. And the impact of that, according to the World Health Organization, that there are increases in lots of issues, including mental health and stroke, heart disease, and even longevity is affected by that.
One second. Just something here. Okay, that's much better. Okay. Perfect.
So I want to I want here to highlight an important distinction between social isolation and loneliness. They are not the same. Social isolation reflects how social interconnection, low social interconnection, while loneliness is subjective. So one is objective and one is subjective, which can be persistent even with the regular social conditions. So it is important to understand what the person we are dealing with have in order to be able to propose the right kind of treatment or approach. For example, if somebody is introvert and likes solitude, that doesn't mean they are socially isolated. But if somebody is feeling lonely while they are in book, then that's a difference too. And it can be clearly seen here when we can extrapolate the two on two different lines. So social connection is more than just a pleasant part of our life. It is a powerful key to our well-being. Strong connections provide a range of health benefits. They boost mental and physical health, they increase longevity, and give us a deeper sense of purpose. When people feel connected, they are less likely to engage in negative health behaviors and even experience stronger immune systems and responses. In short, fostering social connection is one of our most effective preventative health strategies. So understanding the profound impact of social connection on health brings us to a critical question. How can we support those connections in our communities? And that's where pharmacies really play an essential role. And unlike Dr. Boni, Henry's kind of like 3% budget, pharmacists have zero budget for doing that. But they do it by default, and we heard some feedback today about that. More than a places to pick up prescription, pharmacies are hubs right now that foster connection and promote well-being right in the heart of our communities. By providing a space for regular visits, and we help reduce isolation, offering social connection and support that can combat loneliness and strengthen mental health. Pharmacists play a critical role in addressing social determinants of health. But likes this word, but it's still there. By connecting people to local resources, whether it's food, housing, and transportation, and we meet patients where they are, delivering culturally competent and personalized care. That's really going, and pharmacists are going in that direction, really, especially in the last few years. So Canada has approximately around, I would say, 43,000 licensed pharmacists. 70% of them are in the community. So that shows you how much is that. That would be probably around 30,000 pharmacists in the community. Okay. They are convenient and accessible, okay? Meaning people can rely on pharmacists as a first stopper, as advice. Building trusted relationships through frequent interactions. Moreover, pharmacists bring skilled, expert care to the table, offering much more than just medication. They manage chronic conditions, they provide preventative services, support patients in navigating their health journeys. In this way, pharmacists not only are just health provider, but they are also partners to foster healthier and more connected communities. I think this also have become like profound after the pandemic, where pharmacies were the only place that is open. Three things were open during pandemic: the grocery store, the pharmacies, and liquor stores. That's unfortunately true. Yeah, but it, actually liquor stores will give essential service. Can you imagine that? Yeah, we had a crisis like 2 months ago. That LCBO in Ontario, who's here from Ontario, they were striking. They were having a strike, and the first news, while there were 2 wars happening in the world, the first news in CBC at noon, which is the biggest news ever, was about that the amount of booze in LCBO in some stores are getting lower than the critical threshold, so people will not be out of booze. So can I imagine that? So yeah, just to show. So, but after COVID and even before, pharmacy profession has been audited the most trusted healthcare providers probably for the last 8 to 10 years. But these numbers have been boosted after COVID and what pharmacists did during immunization and all that stuff. And even people, citizens, decided that pharmacists should have more role in clinical day-to-day services. So pharmacists nationwide are increasing the gaining power by maximizing their scope of practice. They call it, see the term called it, the extended scope of practice. I don't like that term because it's not an extended scope. We have that scope, but we're not practicing it to the maximum or to the fullest. And now we are allowed. So this is a map of all the clinical services that is not just running a prescription on the computer and give it to the patient, that pharmacists can do across the nation. And you can see pretty much the green is more than the red. I'm not going to say, I hope this is going to be the same tonight, but let's see what's going to happen. So back to the point, we say that put this with all the traditional pharmacy work, plus that 95% can get bid via pharmacy somewhere. So that makes pharmacies really important in providing not only that dispensing, but also COVID-19 testing, immunization of different types, treatments of minor elements, requisition for lab results, extension of prescriptions, so many things that pharmacists can do. And definitely working with the patient on a personal level. So I'm going to show you an example right now why this makes so much sense. This is a new study that just came last year from the Women's College Hospital in Toronto that shows, again, like there was a talk today in the morning. John did a great job, and he talked about somebody asking about gender bias. Actually, this research shows that women are more likely, they are severely lonely to develop a polypharmacy kind of a problem. Okay? So loneliness significantly impacts medication use, especially in older adults, often leading to increased prescription and polypharmacies. A study like this one shows loneliness and its effects may vary by sex, correlate with more complex medication needed due to the overlapping health and mental health issues. Tackling loneliness can simplify medication regimens and enhance quality of life. Pharmacies are well placed to support lonely individuals, particularly older adults with complex needs. So I know who is lonely in my patients. I know. They have a pattern. And we know, they talk to us. If they want one thing that any one of us normally who's not lonely can ask for it in 2 minutes, 3 minutes, hi, I need this medication. That's going to be like 10 phone calls a day to get the same outcome. There's always something. They forget, oh, I want this, and then I wanted that, but oh no, I changed my mind, can you deliver it? No pen, I'm going to come and pick it. Like it's always an issue. And couple that with knowing the background of the patient, which is something pharmacists are very good at, especially in independent community pharmacies, then we really know our patients, so we can definitely play a big role here. So providing personalized care, regular check-ins, managing medication regimens, pharmacists can definitely reduce medication overload and improve well-being. So how can pharmacists really help in this? Pharmacists can definitely help by increasing awareness of the health risks associated with loneliness. We can help reducing stigma, encouraging patients to talk openly about social challenges. Any simple, empathetic conversation can make a world of difference, show patients that they are cared for or they are not alone. And I think one of the things I'm very proud of in creating a practice called open practice, and people are safe to talk about everything they want. My patients would come and say, I want to talk to you, would go to a private counseling area, you can talk about anything. And it's safe and very a supportive practice. So I think that's a very important thing in establishing the trust and allow the patients to talk. This helps a lot. So We can empower our patient to take proactive steps as well, connecting them to community resources, support groups, and social programs that help them build meaningful connections. These efforts transform pharmacies into centers or hubs of both physical and social well-being, supporting mental health and enhancing overall quality of life. I really believe in this so much because Sir Alan Marmot, who is basically the father of social determinants of health, he said something very profound. He said we cannot treat people from different conditions and then return them back home to where the old cause problems are and expect them to get treated. And I always give an example of mold. Like if somebody has a problem with respiratory problem because of mold, whatever you give them, you go to the hospital, you get an antibiotic, you get a steroid, you get whatever. If the mold is not removed from the base they are living in, this is not going to be solved. The same thing. We have to tackle the underlying cause of the problem. And I think social isolation, loneliness, trauma, informed care, ACEs, all these things working together, if we go deeper and start to get to that then we are really having a meaningful improvement in people's life. And social connection and human connection is a huge thing. So empathy is a cornerstone skill for healthcare providers or professionals, especially for pharmacists. When we approach patients with genuine empathy, we build trust and create a supportive environment where they feel valued and understood. This connection goes beyond just dispensing prescriptions. It allows us to understand the broader social and emotional need. By actively listening and showing real concern, we encourage patients to openly share their challenges, including medication or social concerns. This trust helps patients feel comfortable discussing barriers to adherence, ultimately fostering a collaborative approach with us. I'll give you a small example about that. Like, so many patients cannot afford medications, right? One of the things that we had in Ontario is that by default, once the person becomes a senior, they put them as a high-income senior. So you have to pay the deductible co-pay. But there is a form that nobody knows about, except the pharmacist, not the pharmacist. And if you give it to your patient and they sign it, they can actually change it to low-income senior who pays costing. And I dispense these forms, I give these forms to the patients pretty much once or twice a week. They don't know. Then it's so complicated. You need people to help you to navigate. And when it comes to their medication and what is beyond that, which is the affordability and access and all that stuff, pharmacists are really like the cornerstone of the heart of that. This slide is special for Pete. That's all. When direct social connection is challenging, social scribing offers valuable information. I must say that there is a difference between both. Social connection or direct connection is not social prescribed. There is a difference between both. Human connection and social connection is self-motivated. Like somebody needs to sit down and talk to somebody. So it has to come from you. You can motivate people. It's more of a promotion. While social prescribing is more of a structured system, it's a referral system. It's a co-production and co-creation of the service that the patient or the person needs. An example, food, for example, security. If a pharmacist, and we call it for identifying social prescribing needs in pharmacies as well, refers to a lab worker or to a connector, somebody who has food security, then there are so many options. Like before, you have 1-800 number for the food bank of Salvation Army, but right now there are 7-8 different options. So maybe the person doesn't want to go to Salvation Army because they went there before and maybe they didn't have a good connection. I doubt it because Salvation Army is late. But I mean, whoever is there at that day or doesn't want to go to that certain worship kind of organization, but they are okay with something else. So that's where the co-creation is important. And I think, and that clearly shows that it is a very structured system, not what human connection offers, which is more of what the voluntary, casual, more self-initiated, as you can see. The pharmacists are well positioned to support both approaches. We can guide patients towards social resources and create a welcoming support atmosphere that encourage sense of connection. Together, these strategies help address the social aspects of health, empowering patients who will start to build the connection on their own. And I wanna share some good news with you. Like this looks like very nice and theoretical and everything, but also happening in reality. I think the last year or two has shown a lot of progress in that field. So my big Jenny Krishnamurthy is one of the co-founders of ISOC, the Social Prescribing Pharmacy Association. She's in Australia, and she has a practice or an organization. It's called PAS, so Pharmacy Advocacy, Loneliness and Socialization. She actually was able to create the first time in the world pharmacy training on algorithms, and it was launched or talked about last year at the SPI conference in Australia, and listed so that the Pharmaceutical Society of Australia basically hosted the program and offered it for free for all pharmacists in Australia. We are working now negotiating with the Canadian Pharmacists Association to bring this program to CAP. So pharmacists would be able to understand how this is possible. Okay? Now the challenge is always how can we convince pharmacists from the other side that, I mean, they are doing this, but how can we convince or how can we help them to make good structure? Like when you train the teams and work with you as a pharmacist with yourself and the people around you, asking the patients, how are you today? What is going on? Has been any, like, one question I was asked my team too is, anything has changed since last time? That question again triggered a lot of life, like, oh yeah, I lost this, or oh, I got laid off from a job, and this and that. So we can know from those questions, open-ended, as somebody said today, open-ended questions collect data and be able to incorporate it. I sometimes use some of the funded programs in the government that the patient is eligible, like medication review, and I call for okay, let's go down and sit and have a half an hour discussion. I go through everything, medication, everything, and I add a piece of social piece into my assessment that ask almost social questions. People who are quitting smoking, for example, we have an assessment for them, and worrying on the social piece is very important. What do we need? Are they missing something? Do we need this, that? So this is the beginning of the road. I guess it's a long road. I think we need more. We need advocacy, reimbursement, a lot of work. But I think we have a point to start from, and I'm excited about it, and I hope everybody is excited about it. And I'm asking everybody here before I close to think of pharmacy, because you go everywhere, nobody talks about pharmacy. Today, everybody talked about stakeholders in the community, nobody mentioned pharmacy. The pharmacy is the biggest stakeholder in the community for this. You will not have any clinician in the community that have access to all these numbers of people that can qualify for work on human connection and social prescribing. You'll never have that with anyone. Physicians have no time to see this, from my experience. With all respect to physicians, love them. You don't have time for this. Okay, and if somebody talked about it, they say, okay, talk to one of my team outside, they can link you with somebody. Okay, and we should not actually burden the physician with this, because this is prevention. Okay, so this go from upstream down or from grassroots up, whatever you call it, but think pharmacy, because really this is where you will get lots of traction. So to summarize and to conclude, let me recognize that we are in the midst of an epidemic of loneliness and social isolation affecting countless individuals across communities in the world, and it is increasingly prevalent, impacting mental and physical health in WSK. Community pharmacies are uniquely positioned to combat this. They are not just places to pick up prescription, they are accessible, cost-effective health hubs that people trust and provide reliable services. By bridging the gap in our healthcare system, pharmacies enhance preventative care, support chronic disease management, and improve health literacy, strengthening the health of our community overall. At the core of this mission is empathy, It's empathy that transforms our interactions into meaningful connections and ultimately builds stronger and healthier communities. Thank you so much, and I'm ready for questions.
We have time for one, Pete says. Does anybody have a question?
That's unfair.
You have to come to the bar if you want to talk track.
Pete's prescribing again. Okay, well, I have a question. Isn't that counterintuitive for some pharmacists to stop prescribing, to stop selling? Like, is there a conflict of interest there?
That is a very good question, because that's the question my partner actually in the pharmacy, my 50 years old pharmacist. He actually is my business partner is celebrating 50 years as a pharmacist next year. He's pretty much retired. But when I start to do de-prescribing, which is the stopping the medications that are not supposed to be there. And this is part of appropriate use of medication. So I stop the medications that doesn't need to be there, and I actually encourage starting medication that are not there. Okay, so that's called appropriate use. My business partner asked me that exact question. You are stopping medication, we're going to lose business. But the fact that our pharmacy is growing, that many other pharmacies broke pretty much the average growth of pharmacies. And it's not because that you need, so pharmacy kind mandate is patient safe, patient first. We need to ensure patients are safe, they are getting the right treatments, okay? And when you think about that, appropriate use of medication becomes logic. Doing that becomes logic. I tell my patients when they come, oh, I wish I did, I couldn't, I wish I'm not on all these medications. I said, I wish that you are not on all of them too. That's my mandate. I don't want to see anybody on medication, okay? But once you do that, once you show that you are concerned about their safety and that you are having the right stuff, you're connecting with them empathetically, you're creating this connection, you're helping them genuinely, more people will come to the pharmacy. Business will grow. This is not going to go that fast. Yeah, for a second, if somebody think about it with a 50 years kind of back in history kind of mindset, yes, it looks counteractive. But for the future, I think this is the way to go.